What's going on, everyone? It's Alex here from Aleks Physio. So today we're going to be talking about CRPS. It stands for Complex Regional Pain Syndrome. It's a chronic, disproportionate local pain condition that arises after an injury, surgery, or trauma. Also, there's increased sensitivity of the entire nervous system as a result of an inappropriate tissue response to injury with an accompanying immune response that produces inflammation of the nerves that control blood flow, sensation, and temperature, with additional changes to our autonomic nervous system, so our sympathetic and parasympathetic nervous system that regulates involuntary processes such as our heart rate, blood pressure, digestion, etc. Although it can occur anywhere in the body, it usually affects the extremities primarily. The average age of onset is 40, and it affects females more often than males. There are two categories: type 1 CRPS, which has no nerve injury and is also known as RSD or reflex sympathetic dystrophy, and type 2, which has a confirmed nerve injury and is also called causalgia. CRPS typically follows three stages. Stage 1 is the acute phase where pain dominates in addition to sensory changes and edema, and it can last 1 to 3 months. Stage 2 is the dystrophic phase where pain worsens, as do sensory issues, and in addition there are trophic changes now which involve the skin, nails, and hair growth. This stage lasts for 3 to 6 months, and stage 3 is the atrophic phase. This is where pain actually improves, however those trophic changes progress. Let's talk a little bit about symptoms. So the main symptoms follow the acronym STAMP. S stands for sensory, so increased sensitivity. T stands for those trophic changes, so shiny skin, brittle fingernails, lack or too much hair growth. A stands for autonomic, so swelling, edema, sweating. M stands for motor, so weakness, muscle wasting, and contractures, decreased range of motion. And P obviously is for pain. So let's talk a bit about the diagnosis. So there are no specific laboratory diagnostic tools for CRPS, so it's diagnosed clinically. However, various findings of your blood work can be used to support the diagnosis. So CRP or C-reactive protein, ESR, and serum autoantibodies are recommended. To rule out nerve lesions, nerve conduction velocity tests and EMG can be performed as well. And a side note, a diagnosis of CRPS is strongly and independently correlated actually with fibromyalgia, which increases the risk up to 2.5-fold of getting CRPS compared with individuals who don't have fibro. And the risk may also be increased if you have other diseases such as RA or rheumatoid arthritis. Commonly used clinical diagnosis criteria is called the Budapest criteria. Basically, there needs to be continuing pain which is disproportionate to any inciting event, and there needs to be certain signs and symptoms in various categories such as sensory, vasomotor, pseudomotor, and motor changes. And there is a photo that goes over this criteria, and then one of the last parts of that criteria is that this condition cannot be explained by any other condition, so it's almost like a diagnosis of exclusion. Let's talk a bit about causes. So fractures is the most common cause, particularly wrist fractures, because nerves can become injured from a displaced or fractured bone or as a result of pressure from a tight cast. Surgery is another one, so surgical incisions, retractors, positioning, stitches, and post-op scarring can cause nerve injury. The third was sprains and strains, so connective tissue issues to the muscles and tendons from that trauma can permit excess movement of that joint that can also stretch those nearby nerves. And the fourth cause, as we kind of alluded to earlier, is limb immobilization, often from casting, but can be wearing a walking boot or a splint. It can be pressing on nerves and restricting that blood flow, which causes that disuse of that limb, and it deprives it of sensory input, especially if you're wearing something very rigid. And then after that cast is removed, those neurons need time to readapt to the normal signaling patterns that happen afterwards. Because as humans, we're designed to move. We're designed to move our joints, use our muscles, tendons, ligaments, and when we don't for a prolonged period of time, and we don't even have any sensation if we're using something like a cast, it makes it very difficult and can predispose us to something like CRPS. Let's talk a little bit about treatment. So unfortunately, there's no cure for CRPS. However, treatment is most effective when it's started early and it's focused on relieving symptoms, which can help to slow down the disease progression. The team approach works really well, so including an OT, PT, psychologist, physiatrist, anesthesiologist can help because each one plays a role and has their own niche role in the overall well-being of the individual, because we're talking about a human being, not just somebody who has CRPS. Let's talk about some invasive treatments first before we go to the non-invasive. So invasive treatments can include anesthetics, which are injected into the limb to numb the pain. In addition, they can use a sympathetic ganglion block, usually an anesthesiologist, which is injected to target the fight or flight nerves that contribute to swelling and pain. A spinal cord stimulator can also be used, and that helps to inhibit danger signals by delivering a low frequency electrical stimulation to the affected area to help with pain control. The way it works is basically a fine wire is implemented in the epidural space, which is around your spinal cord. And then this is connected to an external handheld unit that allows you to control the amount of stimulation that you're applying, which can help to diminish the intensity of that pain or danger signal. Medications, so several classes of medications can be used and are effective for CRPS. However, none are approved by the FDA to be marked specifically for CRPS, which is something that's important to be mindful of. Some can include Tylenol to reduce pain, NSAIDs or anti-inflammatories such as ibuprofen and naproxen. Drugs proven effective for other neuropathic pain conditions such as gabapentin, pregabalin, duloxetine. Topical local anesthetic ointments, sprays, or creams such as lidocaine. Corticosteroids can help treat inflammation, swelling, and edema as well, such as prednisone. Of course, I'm not a physician, so consult with your GP for more specifics on medication. Let's talk a little bit about non-invasive treatments, specifically from a physiotherapy perspective. This video wouldn't be complete without going into some of the details. Let's talk about how exercise may help. So basically, we're trying to remodel or rewire our nervous system because things are out of whack. We're trying to regulate vasodilation or improve blood flow. We're trying to help release endorphins and trying to release anti-inflammatory cytokines with exercise and movement. But if movement itself is too painful, we can start with something called motor imagery. So graded motor imagery would involve going through visualization techniques and images of either the individual performing the movements, or we can show pictures of individuals performing movements and asking the patient to visualize themselves doing that particular movement, being mindful to show pictures that are likely to not exacerbate pain, because just seeing some of these movements being performed in a photo can elicit pain. That's how severe some of these CRPS symptoms can be. There's actually some research that shows that 6 weeks of this motor imagery and mirror therapy can significantly improve pain severity and functional issues with individuals with CRPS, and that effect was maintained 6 months after for follow-up. The other technique is called mirror therapy. So a mirror is placed so that the painful limb is hidden behind it and you see only the normal limb and its reflection. And the reason why we do that is the brain processes visual feedback more readily than other senses. So when you move both limbs in the same way, the brain sees both limbs moving easily and painlessly, even though you're not actually moving your affected side. It's helping to improve motor control by allowing the patients to focus on the affected extremity. It can help increase perceived ownership of that extremity that's affected, reduce kinesiophobia, which is the fear of movement, and also correct the mismatch between the motor and the sensory systems. Another technique that can be used is desensitization, and can be also accompanied with graded exposure. So with desensitization, we're trying to reduce the nervous system's response to very light stimuli. For example, if someone has an exaggerated pain response to the wind blowing on their skin, we would use something akin to a cotton ball and gently rub it on the affected region. Once this no longer provokes pain, we would progress to a rougher object such as a towel and continue based on tolerance. This would also be a form of graded exposure, as we're gradually exposing the individual to the painful stimuli and progressing based on tolerance. Graded exposure from a movement perspective, we would start with passive range of motion exercise in a very small window of motion, and then progress to larger ranges of motion passively, and then we would do active assisted, so where we take the limb and we help the individual and they're helping as well, and the percentages vary based on how much they can tolerate, till the point where they can eventually do the movement on their own. And once that gets comfortable, allow them to start including some weights and then combining different movements, so it's not just isolated to one joint, but the entire upper or lower body. Lots of ways to strategize and navigate the plan, but again, needs to be individualized based on the individual and their limitations, goals, severity, because again, everybody's different. Pain is so different, and just because you're diagnosed with CRPS doesn't mean that everyone's going to have the same presentation. So because we're on that topic, so the outcomes depend not only on the severity of the original injury, but also on general underlying health and nerve health. Younger people and older people almost always recover who have good circulation and good nutrition. Smoking is a factor that can really affect nerve regeneration and nerve health, and that can constrict the blood vessels that help with nerve healing, in addition to diabetes and chemotherapy. So that means removing barriers to healing can increase your chance and speed of your recovery. Obviously, smoking cessation is very challenging, so even taking smaller steps to help improve your overall tissue and nerve health can go a long ways in your overall recovery. So there you have it. We went over the definition of CRPS, criteria for the diagnosis, causes, signs and symptoms, treatments that include invasive and non-invasive techniques, and how physiotherapy can help you if you have this condition. So do you have CRPS? Let me know in the comments below if you feel comfortable sharing your story. Let me know what are some things that work well, some things that don't, and how the whole process and journey has been in our medical system. But until then, we'll see you in the next video. Thanks so much for watching.